In a busy hospital campus, in the hospital building itself, one man, actually an animal, brutally raped and murdered a 30-year-old doctor who is taking rest after duty. This is even cruel to think about it. Imagine the situation of parents and relatives of the doctor. He must be punished brutally. I don't see it as a sexual violence against doctor only. I see it as one of the worst sexual violence that happened in India after Nirbhaya case. That antisocial psychopath would have done the same thing to any other woman in that situation. The biggest shock is it is done by a friends of police. He was posted as a volunteer in the police booth present in the hospital, which is for the protection of the hospital workers. He also used to collect bribes from the patients and relatives to allow them inside, as well as false promise of better treatment. But I don't know why the media did not sensationalize this news initially. Only after the students and doctors started to protest, it became big news. I don't know why the society hates doctors so much. I can say definitely the percentage of black sheep is far less in health sector than any other sector. Take any sector. I personally urge each and everyone should participate in this nationwide protest because it is one of the worst sexual crime that happened in India. The recent report says there may be multiple persons involved. I don't know how to filter all these criminals from the society. This even happened not outside the campus, not even outside the building, it's inside the duty building. Still some people are doing the victim blaming. They are asking why she had to go there in a seminar room alone and sleep there. Bro, if there is proper duty room, why she would go there? One important request from my side, I urge media not to address her as a junior doctor or trainee doctor. She is a doctor who completed her MBBS some 5 to 6 years back and worked for many years to save lives and then cracked NEET PG and joined pulmonary medicine or chest medicine and studying for last 2 years. In 1 year she would become consultant pulmonary medicine. When we were doing MBBS during our internship, only the second year pages used to teach us everything because professors won't be able to teach each and everything. And something happening to a senior doctor like this, it's unimaginable. So what we can do to prevent all these kind of incidents? Sexual violence against women is going to be there till humans are there. Those kind of people going to live along with us always in the community. So we cannot completely stop these kind of incidents, but we can reduce it. Here I am going to talk my personal opinion regarding what are the measures can reduce these kind of incidents in government hospitals. The government and the government officers should understand that hospital is a violence prone area because health workers have to handle all the extreme emotions of the patient relatives. If they bring an emergency patient, even if it is very late, they expect that he or she has to be saved by all means 100%. But that is not possible even with all effective measures by the healthcare workers. So they express all their anger and disappointment over the healthcare workers. Most of the government medical colleges, there won't be any proper security. If at all, there will be 1 or 2 retired old age Jawans under a security agency, mostly under a politician. Or for namesake, there will be one police booth with 1 or 2 policemen or volunteer, like how they have posted a criminal in the Kolkata Medical College. This has to change. The government should provide proper police manpower to the hospitals, especially near the ICU and emergency ward and operation theatre. And there should be proper patrolling. They have to provide enough amount of security cameras inside the campus as well as all the corridors of the hospital. Before that, they have to improve the facility because all the clashes happen because of the poor facility. For any government, health sector is a neglected sector, especially the government medical college hospitals. They are always underfunded, understaffed, under-maintained, under-equipped. They have to improve these things first and then provide proper security. Very importantly, they have to provide proper lighting inside the campus, inside the corridors, inside all the buildings. Because if you go to any government medical college, the campus is very big. If you walk in the corridor at night, you feel like you are walking in a ghost building. Even the staff nurses who are working there in one ward are scared to go to another ward. This is the situation in majority of the medical colleges, invariably in all states. After doing all these things, in all the government medical college hospitals, each and every staff should be provided with proper ID card, uniform and dress code. Their entry should be restricted with ID card. The patient and the visitors should be given a proper tag. Each and every visitor should be provided with a tag after collecting their ID card. The number of visitors for each and every patient should be restricted as well as the time of visitors, and the movement of the visitors should be restricted inside the campus. And very importantly, we all should cooperate. There are some boomer doctors and senior doctors are there. They don't follow all these things because they feel it is lost their prestige. Without changing this kind of mentality, it is difficult to implement these kind of things. Finally, I would like to mention about our Indian Medical Association's efforts. For the long time, they are demanding for separate Central Protection Act for hospitals. After this incident, our Indian Medical Association President Dr. Ashokan, along with his team, met our Union Health Minister and his team and re-emphasized the same. And very importantly, they have kept one important demand. The security measures of the hospital should be added in the NMC guidelines for permission. And they also said that they will consider it. We'll see how fast and how far it is going to happen. These kind of criminals going to live along with us in the society. Think, work and stay safe accordingly. Thank you.